Hello, everyone, and welcome to our podcast. I'm Danny, and today Great.com talks with Keith Maples, the Chief Development Officer at Neighborhood Health Clinic. If you haven't heard of it, the Neighborhood Health Clinic has been working to deliver quality medical care to low income adults in Collier County. Now, before we begin, remember if you're new here to this podcast, press subscribe on YouTube or in your podcast app. Now back to you. Hi, Keith, and welcome. Thank you so much for joining us today.
Thank you, Danny. It's a pleasure to be here. And we're in sunny Naples, Florida, which is in Collier County. It's in Southwest Florida. We're very proud to be here in the Neighborhood Health Clinic. As we talked about, the Neighborhood Health Clinic provides medical care to low-income, working, uninsured adults here in Collier County. And what's unique about the clinic is in Collier County, we were developed as a philanthropic community, one that gives back but provides the services through philanthropy, and it's not through government agencies. So it was vital that we found the Neighborhood Health Clinic, and we actually started it in 1999. Dr. William Lascheid and Nancy Lascheid were two retired medical professionals where when they retired, they decided they didn't want to really play golf every day. There's other things in life to do. They had a passion for healthcare and helping people and taking care of people. And so actually, Dr. Lascheid, the day he retired, actually came home, talked to Nancy and said, I know too much to do nothing, and we have to do something in our community. And that was the start on a napkin of developing the plan for the Neighborhood Health Clinic. And it was in 1999. So they actually started in January. They had two meetings, 1-hour meetings, and they opened the doors on April 12th, 1999. On that first day, they saw 8 patients. It was a busy day. They were under the impression that probably they'll take care of some folks. They'll get some Band-Aids. They'll take care of some boo-boos. Those are all in Nancy's words. But that day they left, and they left in tears, realizing there were a lot of sick people in our community, and that there were a lot of sick people that needed care. And so they developed the clinic. It was originally started as an episodic walk-in clinic, realizing that we needed to change that and really become a medical home for our patients. They changed that over the years to a chronic by appointment medical facility. We went from a small 3-room building in 1999 to a 7,000 square foot building in 2003 to now where we're sitting today to a 32,000 square foot campus. We have all of our specialty care, all of our primary care, all of our medications, all of our labs, all of our imaging, dental, everything's provided here on campus. If we need anything outside of our scope, we utilize great partnerships with the Naples Community Hospital as well as Physicians Regional Hospital, which they donate that care to us. Our patients actually don't pay anything. So they make a $20 donation to the clinic every month. If they don't have it, they still get taken care of. They get full medications. On average, when a patient comes into the clinic, it's about $1,000 in retail value that they're getting because they come in, they get their full medications, they get their full labs, because again, we create those baselines for our patients. It is their medical home. There is a huge need in our community. In 2013, when the Affordable Care Act started, there was an idea that the clinic may not need, there may not be a need for the clinic. And so they did this study, and it was at the Johnson School of Business at Hodges University. And when they finished the study, they realized there's actually more need for the clinic in our community than they ever thought. The actual estimation was at that point, 50,000 people could potentially qualify for the clinic. So we actually had 11,000 patient visits last year, close to 30,000 procedures. We deliver that on just a $3.3 million budget, but we deliver about $22 million in services. So we leverage every dollar 7 times to deliver that care. And again, what's unique about it is when the Lascheids first started this, they looked and said, okay, it's a 3 to 5 year program. We're going to take care of some folks. We're going to make a difference in the community and move on. And last year, unfortunately, Nancy passed away. And before she did, we had a conversation. And I said, Nancy, what about your 3 to 5 year plan. It's now year 23. And she laughed and said, it evolved. We realized there is an extreme need in the community. And without the clinic, there'd be a lot of folks that would be extremely sick and not getting the care that they need. Our patients average 3 to 5 chronic diseases. We're very fortunate because we're a volunteer-driven organization that have over 700 volunteers. We have 17 staff. Of the 17 staff, 13 are full-time, 4 are part-time, and then we have the 700 volunteers. All of our physicians, nurses, dentists, imaging, all of the administrative, translators, all of those folks working downstairs are volunteers. And what allows them to volunteer is something that actually Nancy and Bill had worked on for 10 years prior to even open the clinic. Actually 20 years, because it got passed in 1991, was sovereign immunity. And sovereign immunity basically allows volunteer physicians, nurses, dentists, any medical professionals that are Florida licensed to actually volunteer their time, provide care, and not have any malpractice insurance. And so it becomes the state's responsibility at that point. It's not been tested at the clinic in any circumstance. I think in the state of Florida, it was tested, I believe, 7 times. What it is the state becomes liable for any malpractice. And again, it's something that they capped it. I think they now have $500,000 that someone can sue for. And a lot of times it's really not something that's worthwhile for people to go after, and it doesn't happen. I mean, again, the clinic probably provides better care than I would get going to my personal doctor. And so, that was something that was special about this when we started expanding the clinic and really doing what we do today. Nancy and Bill wanted this to be a medical home for our patients that they felt that they appreciated, but they felt appreciated. Again, our patients do a lot in the community. They're in Collier County. If you ever get a chance to look into, it's a high cost of living. It's a beautiful area to live, but the cost of living is extremely high. But it's a huge service industry because, again, the tourism. And so in that service industry, our patients are providing those services to a lot of people in our community. And so taking care of them only helps our community grow and get better because, again, we're taking care of all those individuals that are working class in our community that are doing so much. And so, we're very proud of this. We're very proud to take care of our patients. We have great numbers when you start looking at our patients and looking at compliancy rates and things like that. On a national average, for medications dispensing, it's about a 50% compliancy rate for patients to take their medications. Here at the clinic, we're at 97%. We actually started a hepatitis C program probably 15 years ago. And that was because the health department here in Collier County ran out of funding. And they said, it's up to you, Nancy, to take this over. And she did. She ran with it. We've actually cured 141 patients. A patient's cost, if they were to have to pay for that or somebody have to pay for that, is about $150,000 a patient. And we get all those medications actually donated to us from Gilead. We work with AmeriCare's Dispensary of Hope, Direct Relief, those areas, as well as the pharmaceutical companies to get all their medications. So we go through the whole process with a patient. As they walk in the door, we give them, as a first-time patient or as a long-time patient, we give them all the lab tests necessary. We give them all their medications. We sit with them to talk about what's going on. We have translators to help us with language barriers. That's vital. But again, we deliver all that care necessary. It was actually up until 2016 when we did the expansion that we would utilize outside services for our specialties. But it was the vision of Dr. Lashide and Nancy to have everything under one roof. And we finished that in 2019. So we're very proud to have all those services now within our house.
Well, it should be. It's a very powerful structure. And honestly, the kind of service you're providing is very, very unique. In fact, one thing that I was wondering here is that are there any like eligibility criteria for patients to
Yes.
receive services from the clinic? How does that work?
Absolutely. Absolutely. So, as a private organization, all funded through private philanthropy, we created the guidelines and we create the qualifications. So, we get no government dollars, anything like that. So, whenever we realize there's a need, we can make that switch and make that improvement based on our patients' needs. To qualify here at the clinic, you have to be working, and it's basically 20 hours a week on average or more. So, it's 80 hours a month. You have to be 200% poverty, and that's the federal poverty guidelines. And 200% for a single person is about $29,000. So you have to be making $29,000 as a single person, and then that goes up based on how many people live in the household. On average, our patients are about 137% poverty, which is about $19,000 a year. So we understand that and we see that. You also have to be in that you have to have no access to insurance or have any government insurance. So you have none of that. And you have to be between ages of 19 and 64. What's vital about the age is, and then of course a Collier County resident. The age is important because under 19, there's plenty of services provided within the community. And then over 65 and over 64, you become eligible for government health care and things like that. So 19 to 64 individuals kind of have to fend for themselves and realizing that, there's a lot of things out there that really impact our patients. We want to make sure that they're working. We want to make sure that they're taken care of and feeling better. So we consider what we do is a maintenance plan for them, taking care of them, helping them, delivering all their medical needs, and allowing them to go to work every day. Because again, if I call in sick today, I get paid for my sick day. If one of our patients calls in sick, it's going to mean food on their table. It's going to mean a roof over their head. It may even impact their job. So it's something that's vital, and that's why we really went to a point of appointments. We dealt with chronic diseases and really delivered those specialty cares on top of our primary care. Because again, it's making sure that as a patient comes here, they're treated for everything they need to in their visit, and then they can leave. It's not that they come for one visit, we schedule another one, schedule another one, schedule another one. So it's important for them to come, get taken care of, and be able to get back to work and take care of their families.
I love it. And it's very understanding and like fully comprehending the situation that's going to approach you. This is beautiful. But another thing that I thought here is that you mentioned that this big dream of having everything under one roof has been achieved recently somehow. So what's next now? What's in the future for you guys?
So the clinic has a lot of opportunities, and again, as the community grows, so does our patient population. And what we realized was we expanded in 2019. We completed that expansion. We created all the things necessary. Within that scope, we learned a couple of things. So our CEO is actually the daughter of our founders. She's more than the daughter. She's actually a business person, Wharton Business School, worked in oil and gas, worked with labor unions, very, very educated and smart, also an attorney. So when she came to us in 2012, she really changed a lot of the processes with the clinic. What was special about that was when we then ramped up our expansion and looked at our specialties, we added a couple of unique areas. So we added all imaging. When we did that, we added X-ray, CT, MRI, mammography, all those different pieces, and spent several $1 million to do that. Within that, we realized that we could utilize it for a period of time, but full force, we wouldn't use it 100% of the time. And so this is where she moved it into an opportunity and partnered with another imaging facility, a physicians group in town, where they utilize the equipment, they maintain the equipment, they take care of all of our patients for free, and they have their own patient base coming in as well. So we've provided state-of-the-art equipment where they didn't have to take that risk. They then can take care of their patient population as well as ours, and then they pay us to lease the equipment and lease the space. So we created a sustainable dollars for the future, and basically a cash flow for the clinic. And we take that money and we put it into an operating reserve. So we don't even use that for our operations today because we want to make sure that we have money for the future, that she did that. So that was the start. We actually have a lab pathology building we're building on the corner. It's a 3-story building. They'll do all of our pathology stuff, but it's going to be, again, the same concept where it's a pathology group that's going to move into that building, rent the space, lease all the equipment, but provide extra services in the community that weren't here in the community. So not only do our patients benefit, but the community benefits. And so we continue to look at that. We're running out of space. We realize that because of we're over 100,000 square feet of land. We have basically built all on top of it. Eventually, if we need more space, we can look. But that should keep us going for now. 5 years from now, we may see some additional services and things like that. But I think we have the space to be able to incorporate some additional healthcare needs for our patients, allowing for them to get all the care necessary, again, under one roof. And we're very fortunate because, again, when we bought this land, it was a donor that gave us the money to buy the first piece of land and build the initial building. And then we were fortunate to buy the property next door. And Leslie was a success at that as well. So she bought that property before her dad passed and was able to say, "Dad, I got the property for your vision." So without that piece of land, we wouldn't be here today, the size and scope and the care that we're delivering.
Wow. Well, I am actually quite touched about this, she getting involved with it and the transformations that she was able to make. It is really remarkable. And for everybody watching or listening to us right now, I highly, highly advise you to go to their website, which is neighborhoodhealthclinic.org. You can find it on the description of this episode. We try to cover some ground here today, but you can get much, much more information and you can get in touch with them. You can see pictures. You can fully understand what we're talking about. Just go to their website, please. And with that in mind, Kit, since you mentioned like partnerships and donations and smart business decisions, what are the best ways that people watching us right now can get in touch and can help you keep going with these visions for the future?
So the website is helpful because it has our phone number. It has all of our contact information. They can reach out to me from that as well directly, Keith Maples. That's what they can do. They reach out. They can make a donation on the website. They can find out more information. They can see how to volunteer. They can see how to impact our clinic and help our community. Because again, we're volunteer driven. We take no government dollars, and we're all private philanthropy.
Well, please, guys, go check the website. Get involved if you can, or at least spread the word. Kit, thank you so very much for joining us today. I loved to learn more from you.
Thank you, Danny. It's a pleasure, and thank you for inviting us. We're always glad to share.
It was our pleasure, fully. And everybody listening also, thank you. And remember, if you enjoyed the episode, press subscribe on YouTube or on your podcast app, because that shows the algorithms that this is an important conversation, and then more people can learn about the importance of the neighborhood health clinic. And I see you at the next episode. Bye.
Thank you. Bye.